Good afternoon. It is Tuesday, April the 13th, 2021. Sego, David Lahashu Juts, and welcome to today's edition of the COVID-19 Task Force Update on this, our 200th edition of Kahnawake 911. This afternoon, our guests will include MCK Council Chief Cody Diabo, Kyle Zachary of the Kahnawake Peacekeepers, and Lisa Westaway, Executive Director of the Kmhc. Joining us now via Zoom is Chief Cody Diabo. Good afternoon, Cody. Glad you're here.
Yeah, I'm glad to be here as well. Coming to you from my little home office in my apartment. Just wanted to come on to see how the community is doing. I mean, we made it through the winter. Spring is here. The sun is shining. However, I mean, we're still not out of it yet. I mean, the situation around us is still concerning. I mean, Quebec is now into the third wave. They've announced Ontario is in the third wave. So although, as a community, we've fared quite well in this, others haven't. And that's unfortunate, and even though the vaccines are rolling out or have rolled out in the community, I know we're going to be starting the 16 and 17-year-olds. It's not a time really to let our guard down. It's not the same elsewhere around us. Canada itself doesn't have the means, I guess, to produce the vaccines, so the vaccines are sort of limited. Really, this is kind of the new norm for a while. Masks, social distancing, limited gatherings. So really, it's we have to try to find the happiness where we can. The sun is still shining, as I said when I first came on. Life continues, and we have to adapt. And I think as a people, we've constantly shown that we can adapt to the world around us, and we've adapted quite well. And this is just yet another thing that we can put down in the history books, that it's what we got through, the struggles, the hard work that we had to put into it all together. So that's really, I just wanted to come on and say that. I know we're probably looking to start coming out of it. At least I was. It's been a year that we've been here, a little bit over a year, actually 13 months. So since we declared the first sort of state of emergency, and yeah, but we're still here. But we're still going. We're still pushing through, and eventually, I think we can probably say we can start looking back at this. But in the meantime, we need to stay vigilant. Masking is our best defense, the social distancing, and just being mindful. If you go somewhere and it's it's uncomfortable, it's a crowded place, just leave. It's not worth getting sick. The variants are now emerging. They're showing to be more difficult than the original strand. So we have to do what we have to keep the community safe, and I think the goal and what we've been doing so far is working. We haven't lost anybody to it, and that's priority number one.
Yeah, agreed. I mean, we did round a corner with the vaccination campaign that we had. We're still not done. We're still doing that selected group of 16 and 17-year-olds. And I guess the whole idea here is let's make sure that we're all protected, to protect ourselves and to protect our elders and those who are most vulnerable to the virus, and especially now with the variants. And I think that's extremely important that you mentioned that we did round the corner, but it is a daily battle. Even though we're kind of seeing the light at the end of the tunnel, we still have a while to go through with the variants, and continuing with the masking, the distancing, and the hygiene is still extremely important. And of course, now we also have to focus on the mental health of our community, because that's the next part of this. We're already seeing some of the increases in issues, and I think that we have a little bit of assurance here that most of us have received our vaccines, so that's great. Now we just have to hope that the rest of the world gets their vaccine so we can round that big corner at the end of the day.
Exactly, Dave. And with winter behind us, now we can start coming out, sort of emerging from our homes, and enjoying the weather. And that's some of the best medicine I find. Being outside, just enjoying every bit that what life has to offer.
Exactly, and getting outside in this beautiful weather now is definitely very much appreciated compared to the winter that we all endured.
Mm-hmm.
Thank you very much,
So,
Cody. If you have any final words, or
No, just we still gotta keep this battle going. We're winning battles here and there. Like we said, the vaccine, the masking. These are small battles that will eventually bring us through to the great victory in the end. So just stay safe, mask up, hygiene, social distance, and do what we have to for the community.
Great. Thank you very much, Cody. Thanks for joining us today. Take care and stay safe. Okay. Nyawa.
You too, Dave. Ana.
Nyawa. Ana. And that was MCK Council Chief Cody Diabo joining us live via Zoom. Up next is Kyle Zachary, the Public Relations Officer for the Kahnawake Peacekeepers. Kyle?
Thank you, Dave. I will be brief because the Peacekeepers, we don't have anything to update, anything new to update, but I do have a few reminders for the community. There was a release earlier this week recommending that the public use a medical-style 3-ply mask, similar to this one that I'm wearing right now. Well, I'm not wearing right now, but I was wearing right now. We want the community to be aware that this is a recommendation only, and the Peacekeepers will not be enforcing the 3-ply medical mask. However, it should be pointed out that for all buildings that fall under the Executive Director Committee, the EDC, it is mandatory for you to be wearing a mask when you go there. So if you're not wearing a mask, you could be denied access to the buildings. If you're not sure, some of the buildings that do fall under the EDC are the Education Center, the Kahnawake Fire Brigade, KSCS, the Kahnawake Youth Center, Ginakahaga Ungwawana Rowdy Jokwa Cultural Center, Catherine Memorial Hospital, Step by Step, Dewa Dunizakta, and the Kahnawake Peacekeepers. Curfew is still in place outside of the community. We do not enforce the community within Kahnawake. However, you must be aware that if you are outside of the community, you do have to follow the directives that are in place outside. So it's up to you to be aware of when the curfew comes into place in whatever area you're in. If you're not sure, for Montreal and Laval area, the curfew is 8 p.m. presently, and for the South Shore, it's 9:30 p.m. So again, if you are outside of the community in these times when the curfew takes effect, then you open yourself up to discipline from outside police services. And finally, mental health. Dave and Cody were just speaking on mental health. It's an ongoing concern within the community with the emergence of the variants, and just keeping track of all the directives that are happening. It can bring the morale a little low. So if you find yourself struggling, if you're having problems, you find yourself in crisis, you can call the Kahnawake Peacekeepers, 450-632-6505. We will put you in touch with great services, mental health services, and we will go from there. And they will follow through with you. They will follow you on a plan on your mental health to better your mental health. And I mean, again, it's all been said already. We're all in this together, and we'll hope that we can get out of this relatively soon, and with all of us still with our health and everyone around us. And that's it for me. Thank you.
Nyawa, Kyle. Up next is Lisa Westaway, the Executive Director of the Kmhc. Lisa?
Thanks. A few things to update you on today. The first is vaccination. So as you know, we have a special vaccination clinic happening all week so that we can vaccinate 16 and 17-year-olds. So the hours that you can book an appointment for your 16 or 17-year-old are from 3 to 5:30, Wednesday, Thursday, Friday, and from 9 to 5 on Saturday. We just want to remind all of you that if you are 16 or 17, COVID-19, you do have the ability to make the decision on your own should you wish to be vaccinated. So the age of consent is 14, and you can book your own appointment on the Kmhc website by going to Kahnawake 911. And of course, it is something that you should discuss with your family because these are decisions that are nice to make together. So we ask that you communicate with your family as well. We are also vaccinating second doses for staff who had received their first dose end of December, early January, and these are mostly Kmhc and KSCS staff, and that's taking place this week as well at the bingo hall. If anybody has changed their mind from the community and does want their first dose of the COVID-19 vaccine, we do have the Pfizer vaccine at the vaccination site as of tomorrow. We ask that you book an appointment. The reason that we are not able to accommodate walk-ins this week is because we have a very small amount of vaccines and every vaccine is accounted for. We did put some slots into Kmhc to allow for Kahnawake to have first doses. So if you are a resident and you have changed your mind and you would like to receive the Pfizer vaccine, you can go into the system and book an appointment. There are appointments available. I also wanted to remind the community that the pharmacies were offering Moderna vaccine. They both will be receiving 100 doses, and information is available on their websites should you wish to be vaccinated at one of the two pharmacies in the community. So I wanted just to, at this point, as we're nearing the end of the vaccination campaign, or of the first dose of the vaccination campaign, offer a thank you to the staff who have been working really hard at the vaccination site. It's really a collaboration of a multitude of organizations, Kmhc, KFB, MCK, and, staff and management at the bingo hall. Everyone is working really closely together to make this happen and have spent hours and hours at the site in order to facilitate for the community the whole process. So a really big thank you to them at this time. We've vaccinated 74% of the community, eligible community 18 plus. We'll revise those numbers after this week, but we are in a really good place. We've administered close to 5,000 doses of the vaccine. This is really great. Not only are our community members protected, but we've also protected people who come into contact with our community members in order to ensure all-around safety for the community and our ability to get through this. So a really big congratulations to all of you for stepping up to the plate and making this happen. Not just those working at the site, but those who actually went in and showed up. We continue to work through this, and we continue to negotiate to receive our second doses earlier than the 16 weeks that Quebec has planned, and we will keep you up to date with that as we move forward. Also wanted to talk about the testing sites. So even though we're talking about vaccinations, we still need to continuously test for COVID-19, and we still can have cases of COVID-19 despite the protection that we have. And therefore, if you have COVID-related symptoms, we ask that you call the testing site to be tested. We are testing 5 to 20 people per day, depending on the day. So this tells me that people are still having symptoms, are taking them seriously, and are calling in to be tested. Yet we do not have any active cases at the present time. So that's great, but we urge you to continue to come in and be tested, because this is how we monitor, control, and prevent transmission. I wanted to talk a little bit about some of the positives with respect to vaccination that we haven't really touched upon that much, and that's with respect to measures. So all the measures that we have in place right now, distance, hygiene, masking, vaccination, These are all elements that work together to protect us. So Dr. Fuller had a really neat analogy this week that we spoke about on the radio. It's like being out in the rain. If you're just wearing rubber boots, you're still likely to get wet. If you're wearing rubber boots and a rain jacket, well, you might get a little less wet. And then if you add in the umbrella, you're going to get even less wet. So as we add in all of these measures, we're protecting ourselves more and more from COVID-19. And it's really important. Vaccination is a huge aspect, and it adds that extra element of protection. However, despite being fully dressed to go out in the rain, if there is a tornado and a huge downfall, we still can get wet. And that means that if we are in contact with COVID-19, there still is a risk that a smaller risk, but still a risk that we can contract the virus, and there is a risk that we can spread the virus. And that's why we still have measures in place like masking, hygiene, distance, and well-being, of course. We always talk about taking care of each other, which is really important right now, especially more than ever. And so masking measures, because of variants, because of all of the unknowns about variants, meaning how they transmit, at what distance they transmit, if they do transmit, the severity of the cases. Because of all of these unknowns, measures have been increased throughout the world, really, for masking. And Juanita, our infection prevention control nurse, had some interesting things to say about that today. She talked about the 4 C's. So this is something for us to remember. We really need to think about masking in closed spaces, crowded places, close contact settings, and close range conversations. So those are the 4 C's that are really important, and that we always keep our mask on for those situations. So back to some of the positives. So we just want to pull up a chart that we've spoken about at great length, or in that we post on a daily basis, and that's the alert level that we find ourselves in. There's the chart. Okay, so I wanted to focus a little bit on the orange, because every day we basically post that we are still in a red alert level. Why are we still in a red alert level when Kahnawake is doing quite well with respect to number of cases, and really in comparison to Quebec and other provinces of Canada? And that's just because of where we're located, and the fact that we are still at a very elevated level of risk despite that protection that we do have. However, the measures, we've always said that our measures would vary somewhat within those colors. And if we look at the orange, really what we've done, and because of all the hard work of the community, meaning you're following all the measures, you've been vaccinated, you're doing everything right. There's nothing, we have control right now, and because we're taking control over the situation. And because of that, we're able to release some of the measures that have been in place in the rest of Quebec, of the rest of the province, really. So we wanted to go through the orange a little bit with you, just so that we can highlight some of the areas where we have released measures and where we are having a balance between well-being and physical health. So travel restrictions, that first one there, is still in place, and so there hasn't been a release in any of those measures. And as we've said last week, this is an element that we're looking at closely, and we're waiting for more information about the variants and waiting to see what happens in the provinces around us before we're able to release those measures about travel. So again, right now it's highly recommended that we don't travel outside of the province or even outside of the region as much as possible. However, the EDC organization employees are not able to travel, and we hope to be able to release that measure shortly, but we continue to look at that closely. Limitations to visitation at Tbel, Kmhc, and ILC. As we've mentioned, again, this is a measure that's been relieved slightly. We still have to be very careful. However, we are now allowing visitations, 1 visit per week per resident. It's not a lot to start, I know, but it is a beginning, and it is in order to protect everyone all around. But we have released those measures, and nowhere in Quebec are they able to do that at this time. Business limitations. So we know that our retail and our gyms have been open pretty much since June. We did have to close for that short period over the holidays in order to ensure that we protected ourselves, and we see that that was a good decision. However, all in all, our businesses have been able to remain open, and this is really positive. We still have some businesses, however, that are struggling greatly and that are closed, and that we are looking forward to moving towards opening in the future. Again, waiting on those variants and more medical information in order to be able to do so. We have various levels of school closures. Our schools have been predominantly online, very different from Quebec, where schools have been predominantly open and in presence. However, those measures that we've had in place have really served to protect us, and we know that there have been huge outbreaks in schools, huge transmission into families, and the school openings have contributed to number of cases globally and to increase in hospitalization and death, and therefore we continue to keep our schools at this same level. However, we do know that those children who are more vulnerable have gone back into school, and so we fluctuate in that measure in order to meet the needs of the community as much as possible and in order to remain safe. So there is a limit in public or private gatherings, which is very different from in the red, where there is no gatherings at all. So as you know, we have 2 household visits inside, of course, while maintaining distance, hygiene, and masks. And we also are now allowing up to 8 people outdoors only, not inside, up to 8 people with all of those safety measures in place. So again, we've kind of moved away from the red into the orange because of how safe the community is at this time. So that's something that we're proud of in the community, because you guys have worked so hard that we're able to maintain mental health through these measures. There's been an increase in or a decrease in measures related to leisure activities, sports, recreation, as we've opened up many independent sports or group sports up to 8 people. This is the same in Quebec as well. Our community organizations continue to function. Our psychosocial services are being adopted all the time in order to meet the needs of the community, which we know are greatly impacted. Psychosocial needs are greatly impacted in the community as a result of the pandemic. And so KSCS is working really hard in order to meet all the needs that are coming to them in a timely fashion. And all the organizations are going to work together, as we've mentioned on several occasions, in order to normalize the fact that it's okay to not be okay, and that it's okay to take time for yourselves and ask for help when you need it. So you'll see more information about that coming forward soon. We also still have shelter spaces available. We have emergency food services in place. Those services are also being evaluated at the present time to ensure that we are, in fact, meeting the needs of the community, and that what we have in place is the best way to meet those needs. So you'll hear more about that shortly as well. So we just thought that it was important to highlight that at the present time, we're proud within the community that we're able to take care of mental health and physical well-being concurrently at the same time. We're really trying hard to be able to focus on the two so that people can live their lives in a way that is fulfilling spiritually, mentally, physically. And so we wanted to point that out because we think it's important to focus on those positives, despite the fact that there are some unknowns, despite the fact that we still have to protect ourselves from that rain. We want to really focus on all of the efforts that we have done that have allowed us to reap the benefits of these, of everything, all the work that we've done over the past months. So thank you for that. I think that's it for me.
Thank you for the informative update, Lisa. Just one small clarification. Just want to let you know that the 16 and 17-year-olds that are eligible to get their vaccine, they can make that determination whether they want to get the vaccine or not. All medical procedures in Quebec, your age of consent is 14. So no worries there if you have to worry about consent. And that's it for this update. We thank you very much for joining us today. From all of us here, Yawagoa, Danu, Onagiwahi.